Hello to the viewers of New Indian Express. In the last 2-3 months during the COVID second wave, we have been seeing a rise in youngsters getting infected by the virus. Unlike the first wave where it was mostly people above 60 years. Looking at some data from the Tamil Nadu Health Bulletin, between March and December in 2020, it was 29,000 people below the age of 13 being infected by the COVID-19. But however, if we look at 2021, from January to June alone, it has been close to 50,000 people, almost 50% increase in youngsters, especially children and also teenagers getting infected by the virus. Now we have Dr. Aravind S, consultant, Department of Paediatrics and Neonatology at the MGM Healthcare here with us, who will be talking on this subject and explain more about why the second wave is behaving differently with youngsters and many more topics. Let's get into the interview. Hello, doctor. Welcome. Thank you for joining us.
Hi. Welcome. Yeah. Hi to all the viewers.
Doctor, let's go into the first question. Presently, youngsters who are in their 20s, and most of them do not have much comorbidities. If we look at the health bulletin, it says 23, 26, 27 youngsters. They are passing away. They are admitted in the ICU and they're dying also. How these youngsters who are assumed to be healthy without comorbidities ending up in ICU and even dying in the second wave? This was not reported much in the first wave.
Yeah. So I'm sure that's one of the major concerns for many during the second wave, especially. So that's a good pertinent question at this point. So the thing we need to understand about these viral infections is that it's not just the virus that's harming human beings. It's also the human host's immunity that does quite a bit of harm. So just because a person appears to be well built or just because a person is young doesn't automatically mean that the person is at less risk of any severe disease. But there is no available scientific proof as yet globally which would confirm that the virus has suddenly started affecting the younger population in a more severe manner. The more important phenomenon that we have observed in contrast to the previous wave this time is the higher contagiousness of the virus, predominantly attributed to the new strains that have evolved. So I think it's more to do with the more number of people being affected in a shorter span of time. So in any disease like say flu or this COVID-19, when you have a lot of people involved with this infection at a shorter span of time, a proportion of them would anyway be suffering from a severe disease. Say, for example, in COVID-19 in children, what we have observed in the last 1.5 years is that about 1 to 2% of them get severe disease, which require hospital admission, including intensive care. So to put it in simple perspective, if you have 100 children who are affected, you have one or two kids who will be requiring intensive care. Whereas if you have 1,000 kids who are affected, you will be having 10 or 20 of them. You extrapolate it to 10,000, you are talking about 200 or about 100 kids requiring intensive care. So as the absolute number of infected people increase, the number of people who are suffering from severe disease would also increase. So you don't know how each person's immune system would respond to this virus. So that's dependent on huge variety of factors, including genetics and other things. So I think it's more to do with the increased contagiousness and the sheer increase in the number of total infections that people incur. And added to that, of course, the virus seems to be quite an intelligent one. So it's learning from its past experiences. As it jumps from one host to another, it changes its structure so that it can thrive in the human host in a more successful manner. So the virus clearly is learning, whereas unfortunately, human beings are lagging behind in that part. So as soon as the numbers came down in early 2021, most of us let our guards down. So the COVID-appropriate behavior had gradually vanished. And added to that, there were a lot of public gathering, elections, and a lot of gathering even in individual families that were going on. And mask use had drastically reduced. So on one hand, there was a lack of learning from the previous experience on the part of human beings, whereas there was a lot of learning going on with the virus, which changed its structures to suit the human host in a better way. So I think that's the most important factor that's causing this increased fatality in all age groups, including in youngsters at this point of time. So the crux of it is human beings need to learn from their lessons, or else the virus surely will.
You certainly pointed out that a rise in total infections could have also made a rise in youngsters getting the virus. But is it also because of the higher exposure of youngsters post-lockdown relaxations who went out for work, who went out? It was mostly the mostly the younger people who were going out when there was a relaxation in lockdowns, and also the people above 60 and then the people above 45 started getting vaccination. So is it because of the early exposure to youngsters going outside in the relaxation period?
Absolutely, I agree with you. So the thing is, from the experience we all had in the last year, we came to know that the elderly are more severely affected. So in that part, we do see a little change in people's behavior. The elderly are a bit more cautious, and the younger generation are also taking better care of the elderly. Like in the last season, we witnessed many parents. Once they turned COVID positive, the first thing they did was to send all their kids to the grandparents' home, if at all they lived in another house. But this time around, it's not happening most of the times, and doctors are not encouraging that behavior because they know that probably when they transfer a child to the grandparents, they are probably sending a child who's just about to turn positive in a day or two. So by doing that, they're actually spreading the infection to the grandparents. So this time around, people are avoiding that behavior. And of course, not many elderly people are coming out even after the relaxation of norms early this year compared to the younger ones. And of course, as you said, the younger ones are mostly the frontline workers. You can notice most of the policemen who are on the roads performing their duties for COVID are mostly young persons. And even the frontline workers are chosen probably from less than 45 years also. And apart from these unavoidable exposure of youngsters, of course, there are certain avoidable exposure of youngsters also. We can see people moving in groups and children playing around in grounds in many districts in Tamil Nadu also. So there are this unavoidable and avoidable exposure of youngsters increasingly to this COVID pandemic compared to the elderly. And I would definitely agree with you that the vaccination in elderly has definitely helped them to a significant extent, because the role of vaccination is to minimize the burden of severe disease to whoever who's receiving this vaccine. Although it may not totally obviate the possibility of an infection, it definitely does help with the severity of infection. So both these factors do have a role to play in resulting in this increased number of youngsters getting affected and the severe disease in youngsters that we are encountering now.
While COVID pneumonia seems to be the major complications in almost everyone who is passing away in their early 20s or the early 30s, but there is also a factor where a lot of patients get admitted in their most severe period, where if we see the deaths, the admission is just hardly 2 days before the death. So is the late admission also a reason where we are not able to save the person's life?
Yeah, so as we know from the last 1.5 years experience, the virus seems to like the respiratory system more than the other systems, although it does attach in several other systems also. The respiratory system is its choice by default. So the lungs are affected most commonly, whether it's child or a young adult or an elderly person. The lungs are the most favorite site for this organism. And added to that, many of them do not develop clinical symptoms of decreased oxygen in their blood. So conventionally, we used to see patients finding it difficult to breathe as their oxygen levels come down. But for various proposed hypotheses, COVID-19 is causing less amount of clinical symptoms despite a reduction in blood oxygen levels. So by the time the symptoms develop, it already apparently is a bit late for at least some youngsters who present to the hospital, meaning that the pneumonia has progressed to a significant extent. So the problem with this is that delay in diagnosis would result in more accumulative harm to the lungs. Like for example, when the oxygen levels are beginning to drift a little below the optimal levels, when you intervene at that stage and you provide the adequate support that the lungs require, it's a bit easier for the lungs to recover from that part rather than letting it drift to a very severe involvement and depriving it of all the support that you could have given at the earlier stage. That would make the recovery a bit more difficult, I would say, and a bit longer as well. So yes, the lack of clinical symptoms in the early stage and the false presumption that just because we are young, our immune systems are strong and we do not run the risk of a severe infection, all these together put these young people at risk of late presentation, and that's definitely adding, at least in part, to the mortality that we are witnessing among young people. So there's nothing to panic with this concept that I'm explaining about now. All we are emphasizing is that the youngsters need to be cautious about monitoring themselves. they must report to the hospital at the earliest possible opportunity when they notice some warning sign, by which I mean like a fever persisting beyond the 5th day of their illness, or when when they're monitoring their pulse oximetry, that their oxygen saturations are falling below 95%, or if they feel like within a short period of trying to walk within their room, they are finding it difficult to breathe. By which I mean like they are not tolerating a minimal amount of work physically as well. So these are some early warning signs which should prompt them to seek healthcare as soon as possible. They shouldn't delay their health-seeking behavior just because they are young. So all that needs to be done is this to avoid this kind of late presentation.
Recently, even the ICMR has said that the newer variants in India may be affecting younger people more. What do you think when you see patients? Is there anything different in how their infection has spread out compared to the first wave? Doctor, can you explain on that?
Yeah, so I would definitely agree that the younger people are involved in significantly high numbers compared to the last year, because as a pediatrician, we used to witness like 1 or 2 patients a week last time, whereas this time it's like almost every day we get a few kids, like around 10 or so. We are getting those kids, and last time around it was more like the father in the house gets infected, he isolates himself, and then out of a concern they test the children. This time, by the time they present, it's already progressed to the state that all 5 or 6 of them in the home are already symptomatic, and we test them after the symptoms have occurred. It's quite rapid in its progression and its transmission from one person to another. So yes, definitely the numbers in youngsters have significantly increased. But I would say there is no available scientific evidence that youngsters are preferentially getting involved. The increase in numbers involves all ages, starting from small babies, infants, until the elderly. That's probably because the virus has changed its structure. As I described earlier, the virus has undergone certain mutations, by which I mean that it has changed its own genetic structure. And so it has acquired a greater capability of getting transmitted from one person to another and latching on to a person's respiratory system to establish itself in the human host. You could have heard several terminologies in the recent past few months, like double mutants and B1.617 kind of variant. So all these are terminologies that we attribute to the virus after it has undergone those changes. So these changes are not at all new to us. We have been witnessing these changes in many viruses, including the flu viruses. And the changes happen because the virus also follows the concept of survival of the fittest. Because these viruses are more capable of transmission from one person to another, they seem to outgrow the previous version of the virus. And even in India, most of the infections that we are witnessing in the last couple of months seem to be this mutated strain. So I think it's more the virus characteristic. And of course, from the part of human beings, we have also created an atmosphere that is conducive for the virus to transmit from one person to another. So both these factors together have increased the numbers on the whole, not just in kids and young adults alone, but as a whole, across all ages, more people are getting involved because of these factors.
Doctor, in the first wave, there was this message that there is no risk for children, and lesser children were also affecting. Is that changing now? Is there risk for children, even though they get COVID?
Yeah, so I would like to make it a little more specific. So the information that was spread out during the last wave was that children are at less risk of severe disease. Okay. Because this is a new virus and it's a new disease. And I don't think anyone in the world can claim with the meager available data that any particular age group or any particular gender or any ethnicity is actually safe from this disease or its severity. So it's not possible. So what they meant earlier was that the disease seems to be gentler with children. So I think we still encounter the same even during the second wave. It's not like a majority of the children are getting very severe disease. We still encounter the same frequency of severe disease in children, which used to be 1 to 2%. It still seems to be the same. And more than 90% of the children who are testing positive for COVID are either asymptomatic, which means they don't have any symptoms at all, or they have mild symptoms like just a low-grade fever or some headache or body pain. This is all they incur rather. So coming to the severity of illness, actually we are not in a very grave situation as far as kids are concerned. We do come across a lot of predictions about the third wave and its possibility to cause a severe disease in children. I would say at best they are also predictions or apprehensions. or maybe the best terminology you can attribute is a theory, but we don't have any credible evidence that the virus is about to transform itself in a way that it can cause more severe disease in more number of kids. We don't have any credible evidence for that. But the practical implication for that, as far as the viewers are concerned, we are not at all saying that we can afford to let our guards down for the kids. Of course, they do require all the safety precautions that we have been emphasizing since last year, because when the virus changes its structure, it can escape the vaccine. It can escape your body's immune system. But as long as you are adopting all this so-called COVID-appropriate social behavior of physical distancing, cough etiquette, hand hygiene, the virus would still find it very difficult to jump from one person to another, how much ever it mutates. So I think irrespective of whether we get our vaccines or irrespective of whatever we have at our disposal, we need to adhere to these basic measures that the governments and health authorities are recommending. That is going to be a new norm, I would say. Even after the lockdown is lifted, I would say it's always safer for all of us to protect ourselves and our kids.
And what is this condition of hypoxia among youngsters mainly? And it is also said that happy hypoxia, where a lot of cases are being accounted in this way, where the symptoms are not known, and one fine day, it gets severe. Can you explain more on that note?
Sure, yeah. So the term hypoxia, that means like hypo, meaning reduced amount. Oxia refers to oxygen. So the term literally means that the person's blood level of oxygen is reduced. So that's what it means. So what do we mean when we say happy hypoxia? What's so happy about it? So conventionally, since ages, what we have noticed is that when a patient's oxygen saturation goes down, the body recognizes it, or to be more precise, the brain recognizes it, and then it stimulates the respiratory system to function a bit more harder to extract more oxygen from the atmosphere. That's what you visibly see in patients as increase in breathing rate or increase in the effort of breathing. So that's what we conventionally encounter. Apart from oxygen, another factor that drives this is a failure to wash out carbon dioxide. So it's two factors, either to failure to take in adequate amount of oxygen or to failure to wash out adequate amount of carbon dioxide. Both these factors are known to stimulate the respiratory system to function more. And in other words, the patient will become symptomatic. So with COVID infections, experience tells us that many of these patients, for some reason, have near normal levels of carbon dioxide. So that factor as a stimulus for the increased respiratory drive is not there. And with COVID-19, as per some of the postulated theories, the response of the brain and the nervous system to trigger the respiratory system to function more is kind of blunted with this infection. So despite this low level of oxygen, patients seem pretty much fine. They feel well. They don't feel the difficulty to breathe. So that would obviously result in delay in seeking healthcare. If the patients are not monitoring their oxygen levels by means of a pulse oximeter, they are prone to miss it for some time, whereas it could have been picked up earlier. So again, the practical implication of this is that nothing to panic. It is only a small proportion of young adults, especially, who have been witnessed to suffer from the so-called happy hypoxia or silent hypoxia, as it is termed. What we need to do is be a bit more vigilant, and wherever there is a possibility, we can suggest our patients to monitor their oxygen saturation by means of a pulse oximeter. And apart from this, there is something called a 6-minute walking test. So we advise patients to walk for about 6 minutes within their room and then check their saturation once again. If they feel that the saturation is dropping after they perform this minimal exercise, that would also be an early indicator to seek healthcare. So by performing this very basic monitoring behavior at home, and by being aware of the early warning signs, and by reporting to the health authorities at the right time, I think we can still manage this symptom that we are encountering in COVID patients. There's nothing to panic about it or worry too much about it. And what I would suggest not to do is, just because of this phenomenon existing, it is not a good idea to get admitted when you are having mild symptoms. That would mean that the already overwhelmed health system is totally saturated, and those patients who are actually requiring hospitalization would not get beds thereafter. So that behavior is also not warranted. So there should be a balance between these two. A good monitoring, self-monitoring at home, I think would work really well.
Doctor, moving forward, I'll club two questions here. how important is it to fast track vaccination for the 18 to 44 group? And where do we stand in vaccinating the people who are aged below 18 at the moment?
Sure. So that's a good question. So let's see, there are only two ways of acquiring protection from this COVID disease. One is to acquire infection and then subsequently develop an immunity to it. Another is to immunize yourself with vaccines. So with regards to infection, global data so far available to us say that the measurable parameters of immunity in a person, by which I mean antibody levels in the blood, only last for few months at best, and then they seem to wane down. Now, does this clinically correlate with an increased susceptibility to a reinfection? Is something that we all need to wait for us to learn. But we can't be very sure that infection imparts long-lasting immunity to human beings. So that leaves us with an option of vaccination as the only viable choice for us to acquire our immunity. So of course, vaccines are definitely important for all age groups. But then, we are in the beginning stages of developing vaccines, and the production has its own capacity limits. So of course, we would like to cover those population that are at highest risk. Age and comorbidities are still the two most important factors that we need to take into account. Still, the elderly people should be the high priority focus group, and those with comorbidities like increased body weight or obesity, as we call it, or increased blood pressures, or some kind of immune problems, or heart diseases, or respiratory problems that are pre-existent. These should be those people who should be high priority in any country for that matter. So once you have finished covering this population, of course, the next step would be to cover as many people as possible in the 18 to 44-year age group. And I think, historically, we have never witnessed the vaccine development being so rapidly accomplished as it has been done in the last 18 months with COVID. So the progress has been going on at a very rapid rate. But of course, there is a need to step up our capacities even a bit more. And as more vaccine supplies come in, of course, 18 to 44-year age group should also receive that as soon as possible. There has been lobbying going on all around the world, including by the World Health Organization, for the developed countries to spare their vaccines so that the high-risk people and those between 18 to 44 are being covered in developing and underdeveloped countries. So that's been still going on because countries like United States and Canada have started vaccinating their adolescents, like more than 12-year-olds, whereas the health authorities and experts are battling for sparing those vaccines for elderly and high-risk people in other countries. So of course, yes, they need to be covered as soon as we get the earliest possible opportunity to vaccinate these people. Coming to the second part of your question about below 18-year-olds, again, we need to have more credible clinical data, and we need to remember that the data is specific for each vaccine variant. Like, for example, in the US, they have a Pfizer vaccine and Moderna vaccine. Pfizer has conducted a study on a 12 to 15-year-old age group, and that has involved more than 2,200 patients, and they have found favorable results. And so they have already approved for this vaccine to be given for anyone beyond 12 years of age. And so other countries are also gradually beginning to adopt that same concept. Moderna has also done a lot of studies involving children ranging from 6 months of age until 12 years. And their data is about to be published and recognized. And soon they will also get their approval to vaccinate kids as well. And again, Moderna has tested their vaccines on about more than 6,700 patients. But in India, the vaccine varieties that we are having, that is the Covishield and Covaxin, are different from both these vaccines. So we lack data with children with regard to both of these vaccines. Just in the second week of May, to be more precise, if I'm right, I think it was on the 13th of May 2021, that the Drugs Controller General of India had approved pediatric trials to be carried out with Covaxin. So they are just in the process of enrolling kids in this vaccine trial distributed across 5 places in this country. But we must remember that the number that they are looking at is around 525. So you can contrast that with the 2,200 or 6,700 that the US vaccines were tested on. So at the end of this vaccine trial in India, the data we will be obtaining will be crucial, but whether it will be adequate to recommend it for all kids below 18 years is for all of us to wait and watch. But at best, I do not expect these data to be available anywhere before the end of 2021. And so we can only, at our best optimistic expectation, we can expect vaccines for kids only in the next year. So in this context, I would also add that Bharat Biotech, which is also manufacturing this Covaxin, is working on another great novel concept of introducing a nasal spray vaccine for COVID-19. If this turns out to be successful, which again is very unlikely before the end of this year, that would be a very good option for everybody, including the kids, because of several advantages. One is that since it's administered in the nose, which is primarily the point of entry of this virus, it can be blocked right at its point of entry. Another is it is logistically much easier to spray some vaccine in the nose rather than administer an injection, which requires technical expertise. The cost will be less. The storage conditions will be less stringent for this nasal vaccine. So if this turns out to be successful, who knows, it could be a game changer in the future as well. So at present, the kids are not considered a high priority group as we are standing today, because the frontline workers and the elderly people are still yet to be vaccinated to a significant extent. And the data, especially with the Indian vaccines pertaining to kids, is still lacking. So we still need to wait until at least next year for us to begin that endeavor.
You anyway mentioned that the rise in infections could also be the reason why more younger people are getting the virus. But should we still have more studies on how younger people are having severe infection in the second wave compared to the first wave?
Undoubtedly, yes. Yeah, I would say undoubtedly, yes. This is a new virus. The disease is new. The many manifestations it's causing in various age groups is very new. And to add more to the complexity, the virus is undergoing changes resulting in new and newer strains of virus being evolved in a span of few months so frequently. And the effect of the vaccine on these mutant strains are changing so dynamically. So of course, there is a lot of scope for research. And indeed, as you mentioned, the effect of virus on youngsters need to be studied more in detail. Despite the huge clinical burden that clinicians are encountering all over the world, I must say in the last 18 months, people have done a tremendous job in putting their brains into understanding the pathophysiology of this disease in both in adults, youngsters, and even in kids. There are lots of theories that have been proposed and management strategies advised. So definitely, it's an ongoing process. It is already in place, and it sure has to be in place even in future also for us to adopt the right strategies for each age group.
I finished all the questions part of the interview, doctor. Would you like to add anything, especially to parents and youngsters who are watching this, would be watching this, on what precautions they can take in terms of being cautious in the second wave or the future also?
Sure. Thank you for that opportunity. I think it's very essential to emphasize certain things, even though it might sound as a cliche by this time. So as I said in my talk already, I think rather than looking for a magic bullet or a medicine or a vaccine that's going to suddenly wipe out this virus from the entire world, what we need to focus on is the basics. The COVID appropriate behavior of putting on a mask, adopting physical distancing, adopting hand hygiene, and avoiding gatherings at the moment. So these are the most essential aspects of COVID appropriate behavior on the part of general public. And added to that, I would also emphasize, handling children is a bit different from adults when it comes to healthcare, not just with COVID-19, but with the most diseases and even taking care of their well-being as well. The reason why I'm emphasizing this at present is because we are encountering a lot of kids who are being brought to us for the first time, and the parents or the family members had already self-medicated these children based on the prescriptions that they received. Many children report to us who are already on some course of antibiotics. Some of the children are also on steroids. That's extremely dangerous because especially even in adults recently, you would have encountered this risk of mucormycosis and other fungal infections. Of course, children are also at risk of these infections if you're going to pump them with steroids unnecessarily. So my point of emphasis will be to not to perform any tests as well. A lot of kids are undergoing CT scans unnecessarily. That's again mostly not essential at all. We are hardly performing CT scans for 1% of kids, if at all I'm not exaggerating. So please do not perform any investigations, even blood investigations. Most of the kids do not need blood investigations. So don't perform unnecessary tests, including scans. Don't pump them with medications, especially steroids and antibiotics. They're not going to help the child at the wrong times. If they're really requiring steroids, they should already been admitted in the hospital. So never try that at home. And please always follow the doctor's prescriptions and try not to extrapolate the knowledge that is available for adults onto children, whether it is vaccines or whether it is drugs as well. So by just sticking to the basics, I think we can win over this virus. It's not as difficult or as pessimistic as it at present seems to be. It just needs the cooperation from general public, the government, the non-governmental organization, the healthcare. We all need to work together to put an end to this pandemic altogether.
A lot of thanks to you, Doctor, for being part of this interview. Thank you so much.
Yeah, thank you so much for the opportunity. Yeah. Thanks a lot to all the viewers too.